Hello, everyone. Today we are here with Dr. Contreras, a pulmonologist and sleep specialist based in Fountain Valley. Thank you so much for being here with us today, Dr. Contreras, and we're here to just ask you a couple of questions.
It's a pleasure being here. Thank you for the invitation.
Yeah.
All right, started with the first question. So, what originally drew you into medicine and what led you into your specialty?
Yeah, I knew always as a kid, mostly because I was pushed by my grandma to pursue medicine. But I was actually a shoo-in for it because I've always been very sort of intuitive and logical and always enjoyed math and science. And so, as I did more sort of volunteer work in hospitals and things like that, I realized that medicine is sort of the bridge between science and people. And it's more than just it's more than just individual sciences or individual subjects like math and things like that. It's truly the bridge of what we discover in science and how we apply it and improve people's lives. And so there's more than just knowing science and knowing math. It's knowing how to deal with people and how to be social, how to be empathetic, how to listen. So really, you need a lot of people skills, and sort of that was what really got me excited about pursuing medicine. As far as pulmonology is concerned, interestingly enough, it was also kind of a shoe-in because pulmonology is very much sort of numbers oriented, very logically oriented, a lot of data with different numbers, like when you're doing pulmonary function tests, like when you're dealing with patients on ventilators and things like that, there's always a lot of numbers, a lot of math that you're dealing with. And so it was actually a perfect fit. And then, of course, helping people breathe is extremely important. It's a very debilitating condition when you can't breathe. It's something that we generally take for granted. People that have trouble, lung issues, they really struggle and they really need help. And I'm always extremely happy to see people improve. So all in all, I mean, medicine was the perfect fit for me just because of those two, that bridge, serving as a bridge for people in science, and pulmonary itself was just, it was actually kind of went back to the basics of I really just enjoy math and enjoy sort of dealing with numbers and stuff, and pulmonary is just like that.
Yeah, I completely agree. Um, so just kind of moving into our second question, what does a typical day look like for you in pulmonology?
Yeah, it's like probably any other medical specialty. I usually start the day rounding in the ICU because those are generally the sickest people that require the most attention first. Um, so I usually wake up pretty early, probably between 5 and 6 in the morning, just start reviewing the patients to see what happened overnight. Then go in usually by 7:30 or 8, start rounding on the ICU patients, seeing all of them, touching base with the nurses, seeing what happened overnight with the nursing aspect, then with respiratory therapy. And then usually once I get done with the ICU, I'll talk to families if we need to talk to families because many of those patients are very critically ill and there's a lot of changing things going on and families need to be updated. So usually I'm done by 9 o'clock, 9:30 with those patients, and then I'll move on to the medical floors where the less sick people are, or the ones that have been transferred out of the ICU. I'll go the wards, and then I'll see those patients are usually pulmonary patients with pneumonias, with asthma, with COPD, that kind of thing. Um, I'm usually done around between two hospitals, so I go from Orange Coast, then I go to Fountain Valley. I round there. I'm usually done by around 11:30, and then I'll come to the office by 1, and then I'll see patients from 1 to 5. Um, and so, I'll see patients here for sleep apnea, for asthma, for COPD, and generally, these are follow-up visits or new patients that I see here. Once a week, we'll do testing for pulmonary function testing, and then every day, I send out home sleep tests for patients. So they'll take a test with them, and they'll bring it back the next day, and then usually I'll review it by the end of the week. I'll take a look and see if they have sleep apnea or not. Um, And that's pretty much it. And then on weekends, I cover the hospital probably once every 3 weeks. So I'll help cover two other physicians. So I'm carrying their patients too. It's usually a pretty heavy weekend, probably 30, 40 patients around there. Those are pretty busy weekends. So, but yeah, no, that's a day in the life on a pulmonologist. And I think most, outside of the ICU portion of things, I think that's how most medical specialties round. The cardiologists, maybe cardiologists are a little more procedure heavy. They probably do, rotations of, left heart cath and things like that. But for pulmonary in the ICU, you do procedures in the ICU nearly every day. But otherwise, it's just seeing patients, talking to families, and rounding on floor patients, and then the clinic, of course.
Do you also handle critical care?
I do, yeah, yeah, yeah. I do critical care as well. So these are patients that are extremely sick, the sickest people in the hospital, that are on either ventilators or they're on medications that help support their blood pressure, or they need frequent monitoring by nursing staff, or they need a lot of labs very frequently. Yeah, yeah, take care of those too.
That seems like a lot of time commitment. Would you say that you have it's like family time at home when you come home, or would you say you worry about the patients as well at home?
Yeah, yeah. I mean that. Thankfully, I can usually make it home by 5:30 around there. Um, there's days we have a call panel, so we have a call schedule, so we're on probably every third day. Um, and so on those days, you'll get called from the hospital to come back in, go to the emergency room, do an admission for the ICU, or do a pulmonary consult, things like that. But no, there is time. 3, 4 days out of the week, you're home with family by 5. Um, every, you know, first and second weekend, you're off. So you spend time with family then, and then I'll take, 5, 6 weeks of vacation. So yeah, plenty of time.
Okay, just moving forward. What's one challenge in medicine that people outside the field don't really see?
Yeah. Um, as far as as a physician going through medical school and stuff like that, the challenge is the challenge. The challenge is not that medicine is difficult. It's just there's a lot of it. There's just a lot of information. You have to be very, very good at organizing information, being very logical, knowing the science, and of course, being able to remember. So memory is a very important part of medicine. But as well as logic, I've seen both ends. I've seen people that have extraordinary memory and they're able to memorize everything, but they're not terribly logical. I've seen people that are logical that don't necessarily have to study and memorize everything, but somehow do very well. And I've seen people that are both, that are obviously those guys are really good. So it's challenging the amount of information, and it's not as though it's a static base of information. It's not static. It's ever changing. So every year, some new study will come out that this drug is better than that drug. And you have to keep up with those changes all the time. And many times it's hard when you're busy practicing every day, and you come home, you're kind of tired. You don't really want to keep up with everything, but it almost comes to you, because your other colleagues will find out about something and they'll tell you, and then you got to go back and read and see. So it's you're always studying. You're always learning. There's never a point where you're kind of taking a break, because that you end up falling behind as a physician. As far as like in practice, what are the things that you don't see? Um, in practice, the biggest problem I think we face as doctors is that there's, number one, a huge administrative burden, meaning there's a lot of paperwork, there's a lot of back and forth with insurance, a lot of back and forth on payments. Sometimes insurances don't want to pay you. There's a lot of, but patients can sometimes be very demanding, demanding in an unfair way sometimes to physicians and nurses and things like that. What else? Um, when you open your own practice, I'm sure your dad has told you this, but it's very difficult. Number one, to open your own practice. Number two, you have employees. You basically run a business. And it's like any other business, you have to keep up with your employees, keep up with their pay, keeping them happy. So you're always sort of trying to keep everybody happy, right? You're trying to keep the patient happy, you're trying to keep your employees happy, you're trying to keep hospitals happy, you're trying to keep nurses. I mean, it's a lot to handle. So there's a lot of stuff on a doctor's plate. And people look to you, they don't look to you and say, oh, we feel sorry for the no, nobody feels sorry for you. It's a huge role and a huge responsibility you take on. Nobody, is very forgiving when you make a mistake. No one is forgiving towards doctors because they look at doctors and they say, "Oh, he makes a lot of money. Oh, he's smart. He should have known." Or, "Oh, So it's a lot of pressure on doctors. So I'm sure you'll hear about doctors, that are depressed, that are, you hear all sorts of different things about doctors because it's a lot of pressure. It's a lot of pressure. You can't let it all kind of come on to you and let it take over you. You just gotta take everything one thing at a time and move on.
Yeah, I think that's really cool. I think it's really important to notice the challenges and then, but also notice like the benefits, of course, of being a doctor. But I think it's really good that you highlighted that. But I guess like kind of going off of that, like the challenges and benefits, I guess like very briefly, since you can kind of expand on this and like you're meeting with the student, but like what advice would you give to students who are interested in medicine but aren't sure where to start?
Um, if you're interested in medicine, you got to get out there and see it, exactly as these students are probably doing, going out, hanging out with doctors, seeing if they like, talking to patients, seeing if they like what the doctor does, seeing if they like how their schedule is, seeing if they're scared of blood or not, that kind of thing, seeing if they're scared of seeing like, wounds and seeing stuff that, you don't normally see day to day. If you're comfortable with it, if you're excited by it, then maybe it's something you can do. Obviously, what you're seeing is the end product. The process to get there is it's a different process, right? Because you have to do all the stuff you got to do for school. You got to be pretty much top of the class for everything. You got to go through this long journey and path of medical school, clinicals, residency, specialty training, and then finding a job and then keeping the job. So there's a lot of different things. You got to go, see the end product and then be ready for what the path looks like. Because the path is a tough one and not
Yeah.
guaranteed, by the way. It's not guaranteed. Because at every step of the way, right, for everything, there's always some challenge. It's hard to get into college, right? Hard to get into medical school, and it's extremely hard to get into residency. So it's always a challenge every step of the way.
Yeah, you really have to truly love what you do to make it worth it.
That's right. That's right.
hmm What are some of the most common cases you see on a daily basis?
In my case, in the ICU, generally I see a lot of infections that get out of control and result in something called shock. Shock is when, basically the body's immune system releases proteins that cause blood pressure to drop as a way of fighting infection. And so they end up in the ICU. That's usually the most common diagnosis for an ICU patient. And they have to be on medications to keep the blood pressure up. Another common diagnoses or thing that I see in the ICU is someone who ends up with, pneumonia with very low oxygen levels, and then they need to be on a ventilator. That's another pretty common diagnosis. On the medical floors with pulmonary consults, I'll see a lot of what are called COPD or asthma, things like that. So patients that have smoked in the past and damaged their lungs and they can't exchange air well, those are guys with COPD. They end up in the hospital for 3, 4 days, many times, trying to come off of oxygen or trying to come off of steroids. In the office, I see a huge combination of things, but mostly a lot of sleep apnea patients, patients that snore and stop breathing at nighttime and need to use what's called the CPAP machine. Those guys, they come in, probably 50% of my practice is that. And in the office, I'll also see the COPD stable patients, that are on inhalers and stuff like that, or they might be on oxygen. Um, I see a lot of the hospital follow-ups too, patients that were in the hospital a week prior, and then they're coming in to make sure they get all the right medications and that they're recovering well and things like that. Those are very common. The other thing I didn't mention, I see a lot of patients that are in what are called LTACs, so they're long-term acute care hospitals. They're patients that were not able to come out of the hospital because they were so sick. They're very weak. They're very sick. They might be on a ventilator. So I'll see ventilator patients there as well, actually. Those are extremely, extremely sick people. Those are patients that I'm trying to wean as quickly as possible off the ventilator, but many times it's very difficult. They're very weak, like they can't even lift their arms, kind of thing. I mean, it's a very, very tough situation to be in. So I do see some of those as well every morning, actually.
Oh, that's really cool. I think that variety it's pretty cool. I think that's like a cool part of being a pulmonologist. It's like you get to see so much different parts of like the medical world. You get to be in the ICU, you get to be in clinic or on the pulmonary level, and then I guess everything between as well.
Yeah, that's true. Pulmonologist is probably the one field that you can see every single, every span of healthcare. So from, somebody that walks into your clinic to somebody that can't walk into your clinic, to somebody that can't even, breathe on their own. I mean, the entire span of medicine. I think that was one of the other reasons why I really liked pulmonary, was because it's not like, say, ER or anesthesia, where you're always in the same setting, right? You're always in the emergency room, you're always in the operating room, you're always with critical care. I can be in the ICU an entire day, right? I can be on the floors seeing patients an entire day. I could be in the office, I could be in an LTAC, I could be in a nursing home, I could be anywhere at any given time. So I can change my environment at any time if I get too tired of something or whatever.
Mhm. Yeah, that's really cool.
It's amazing.
Well, yeah, I mean, I think that's about all we have for today. So, like, thank you so much, Dr. Contreras. I really appreciate
Cool.
it.
Really
Cool.
appreciate it. Thank you so much.
Awesome.
Yeah,
Awesome,
thank
guys.
you.
Hey everyone, thank you for watching our video. For more information, check out the link in the description at healinghandsmentorship.org. Click the link down below for our student interest form, or click here for more videos.